Andrew, you can give us a little bit of introduction to what you're currently doing, what you do with WHO in the country, and give it a start to the discussion.
Okay, thanks so much, Yancha, and colleagues that have joined. Just to mention, I'm under Bakainaga. I've worked with the World Health Organization for 10 years, actually 11 or so. And I have been in 3 major fields. For so many years, I've been in the immunization field and with different positions, but basically immunization, vaccines, development. And then I have also worked for quite some time in the emergency preparedness and response. And yeah, as you know, Uganda is a hub for pandemics and epidemics. So we've been busy in that area. And then currently I am in a new portfolio, which is health systems, but specifically looking at subnational health systems development and strengthening, management and strengthening, sorry. So this has been created, WHO 5 years ago embarked on a functional review, which was to make WHO more responsive to the country's needs. And in that, they tried to find out what are the new areas where WHO needs to come in, which the countries are facing challenges. And the subnational level in Uganda, those are the districts, the regions. We don't have regions administratively, but we have regions in the health sector. And also those that are below the district. These areas are quite a potential threat for the health performance because we have not given them as much support, yet they are the ones that actually implement, and Uganda runs a decentralized system. So it's been a contradiction for so many years. But now the WHO thinks that focusing on their subnational levels, strengthening their systems, institutions to deliver health would be a worth investment. And specifically for Uganda, I've been asked to lead that area. So yeah, so as Yancha said, that's me, and I'm glad to be on this call. Over to you, Yancha.
Thank you so much, Andrew. You've already mentioned a lot of things that I didn't even know, and I got really interested to hear more about those strategies when you focus on the subnational level, because you said that they cause potential threats to the overall performance. So maybe to give more details on what are actually the challenges, why would they be the potential threats, plus where exactly is WHO focusing to support those?
Okay, just like you know, or some others would like to know, the subnational level, because Uganda operates a decentralized system. The districts are really the key entities when it comes to implementing. The national level has decentralized to them, so they are the ones that actually do the implementation. The national level does the guidance and oversight, but the implementation is done at the district level. So mentioning that just means that you need full capacity at the subnational level in terms of the human resource, in terms of your management capabilities, and also definitely the financing, which is a core for human resource. So looking at that, you'll find that if you don't address specifically those areas of concern, then you have big challenges. Let me give an example. We have for so many years sent through money for immunization, funded by Gavi, but through our national system. But recently, for the last 2-3 years, we've had the biggest problem being that districts are failing to account. And if you drill deeper into what are the reasons for districts failing to account, you'll have a diverse array of challenges within the system itself at the district level that makes it difficult for them to actually account timely. So as I mentioned, you would assume that if you send money to any entity, they have the the capabilities to undertake that activity, implement it, and then account to you. But that's not what we find. And so trying to internalize those real challenge, not perceived challenge, but the real challenges that they face, and supporting them to address them is really core. The other is that it's always assumed that when someone is given a position, they just by luck inherit managerial and leadership skills. That is a fallacy and it is false. So you have people filling in positions, but they are actually a problem to the system. So we're also looking at how do we work with them to build their capabilities and see that they offer leadership and management that is worth delivering a good system for performance. So really, those are some of the things that we are trying to work with at the district level. Issues of monitoring are quite a big challenge at the district level. Do they have monitoring tools, and are they equipped for using that to improve their performance? Do they share with their political and other leaderships so that both sides of the management and top leadership of the district can call each other to account? So those are things that would actually be an incentive if you have, for example, a political leader in the district knowing your immunization performance and then calling the DHO and saying, why is it that my district is among the last 10 in the country? That in itself is an incentive for the technical arm to really get back to their feet and start working. So those are things that we are looking at, working with the districts and putting in place and hopefully seeing a really major shift and change in performance. Over to you, Yancha.
Yes, so I see that you have a lot of issues with districts failing to account for those finances that are invested. And you said that if we would dig deeper to why they're actually failing to account, could you give like more details to what exactly leads for this weak accountability? What happens at the district that those finances are not accounted for?
So one of the things that, I will just give some very shocking one. So you plan a campaign, you hold your planning meetings of the campaign at the national level, you engage a district health officer who's the head of health at the district level. So he's aware of all your plannings and is aware of the money that is coming. And then when it gets to the point of implementation, you are not sending that money to a DHO, not at all. You are sending it to a chief administrative officer who is literally the permanent secretary at the district level, who, first of all, receives every money that comes to the district. You will receive money for roads, you'll receive money for agriculture, you receive money for health, you receive money for education. So for him, his receiving is like a bank. So then you will then come to him and say, oh, we need this money because next week we're going for the campaign. But he has all these other huge amounts of money that are for roads, which are equally urgent. So how is he going to prioritize your campaign, which you planned outside of his knowledge? And then all of a sudden it becomes an emergency for him and he has to attend to it. So what happens is that the district will go ahead because the national has set up the dates and will implement. The health workers are not paid, they are frustrated. Then it comes to the actual payment, then he goes into the details and says, oh no, you didn't have this, so I'm not going to pay this, then you can't pay this money. Then after that, we want accountability. Then the district is saying, oh, we can't account because we still have money pending to be paid because this was not available. So that comes to 1, 2, 3 months, and we are still struggling with the district to pay. So just giving you an insight of what it means, for example, to work closely with the district, understand their system, understand how it works, and then work within those structures. Because at the national level, yes, we're in the country, we assume we know, but we don't. 2 years ago, we had a campaign. I think it was a polio campaign. We sent money midway the financial year. It was off budget. So at a district level, the councils have to sit and approve that budget that is, that fund that is outside the budget. Now the councils said, oh, but you're telling us to come and sit. Our regular meetings are 3 months from now, but the campaign is supposed to be held that month. So you see, my point is, and as long as you don't know how is money in the district channeled, how is it approved, how is it disbursed, how is it, all these should fall in line with the national level planning so that they are catered for. Whom do you need at the district level, for example, to run through these fund release and accountability? There's a person called the Chief Finance Officer in the district. He, most of the times in our planning, even when we're bringing people at the national level to have a conversation around these activities, we don't call him there. So at the end of the day, the DHO that you are always with in your plannings can't do anything because he has no whatever over the money. So the Chief Finance Officer also says, oh, I didn't know, now I need my additional auditors or accountants to go through this and all that. So anyway, I hope I've just given you an idea. Over to you.
Yeah, you gave a lot of idea. This is it's a lot going on. And you said the DHO, he's the one involved in planning, but then the Chief Administration Officer, he's not part of any national planning. Is there some kind of miscommunication as well happening between those two at the district?
Yeah, it's not a miscommunication. It's just maybe I would blame it more on the national level because we as a health sector technically deal with the district health office. So on technical matters, you are doing nothing wrong if you directly connect and engage a DHO. But we should understand that when it comes to other administrative and financial issues, they are beyond a DHO. So whereas you assume that you are going to orient and train and do whatever a DHO and you go down and do it with a cow, with the Chief Administrative Officer, that's not always the case. So what I'm saying is that at the national level, you should be able to understand the dynamics in the district. And if you want to do a planning, you then involve all those stakeholders. You will involve the Chief Finance Officer, you will involve the Chief Administrative Officer, and any others that would deal on the other side of how do you bring back accountabilities, because that's also another area that we've seen. When it comes to accountabilities, then the Chief Finance Officer says, no, but I need auditors to go through this before I send it to you. And then you did not either plan or work with the auditors previously. So that, my point is that when you know the nitty-gritty, the detail, the detail of what happens in a system called a subnational district system, when you know those dynamics, then you are very well equipped to ensure that all those dynamics come into play when you are undertaking or planning an activity. And once you have them all on board, then your system works as clockwork. Over to you.
This is a really good insight. When you talk about the national level, who is the one that is involved in this planning? Who is the one that should be well aware of those dynamics to strengthen the accountability? Is that the ministry? Is that the different partners? What stakeholders are involved?
So it's the ministry, because most partners will implement through the Ministry of Health. So if it's a program, for example, UNEPI, it's the program manager who is more supposed to have those sort of insights. For other partners that do direct implementation at the subnational level, I think they are better off in that area because they are working with the districts closely, and usually they know those dynamics. So at the national level, it's the program manager more than any of us, the national partners.
Yeah, I understand. You mentioned regarding the health workers being frustrated for not being paid. And I remember this situation exactly because we were involved in the COVID-19 campaigns, and I've been part of those different WhatsApp groups. And I remember that it was already the third or second campaign, and it has been months afterwards, and they were still complaining that they have not received any money for the first campaign, which happened way before. So I see that, all of those administratives that comes with the accountability, all of those mechanisms, they're standing in a way of also allowing the health workers to be paid. And then, you know, those are on the ground. You need them to be motivated to do well. And if, of course, if they don't receive the money, then the motivation goes down. Maybe Ibrat, Anushka, or Ian, do you have some questions?
It's more like a follow-up question around, just clarity from Andrew. When it comes to the payments, I think, is this money coming from, WHO side, or the money is coming from the government side through Ministry of Health? And as the money comes in, have there any tools that have been used, like in terms of, visibility tools that to allow you see how the money is being paid, so that, you don't have actually to go back and ask for any proof of payments if there was a system that, as WHO, you have visibility into for those payments to be made. So I just want to understand, one, is the money coming from the Ministry of Health, or the money is coming from WHO? And then two, are there any tools, any payment tools that have been implemented in these programs that can give WHO visibility in these payments?
So thank you so much. The first question, does it come from WHO, Ministry of Health? It's both, because
Okay.
WHO has two funding modalities. One is called the DFC. DFC is Direct Financial Cooperation. Here we enter into an agreement, or we already have agreements, for example, with the government. So that one is usually direct. Let's use an example, MR campaign was purely funded 100% by WHO. So you send money, for example, to the Ministry of Health under the DFC, and then the Ministry of Health will send it to the different entities, which are the districts. So that way you've channeled your money through Ministry of Health. Over the years, we have had our own challenges with that method, because once you send, for example, 20 billion to the ministry to send through to the districts, and 6 months down the line, you haven't closed that activity, our system at the global and regional level will close and lock you out for every other funding. So the office comes to a standstill. So because of that, we then have our other modality, which is direct implementation, where WHO actually can have a direct implementation agreement with each of the 100 and something districts. So we can send money directly from WHO to the districts. So that it's two-pronged, and we can use any of those two methods. In your other question, you mentioned around the tools. We don't have those tools. If we had them, our life would be marvelous. We would just go home and sleep, because then it cuts out the challenge of following through, which is really, really quite a headache. Actually, it's nearly impossible in our current setting of Uganda. So if we had tools that gives us an insight into how the money is paid out and the activities are implemented, and we could get quote unquote accountability in real time, I mean, that would be heaven sent. Thank you. Over to you.
Great. Thanks, Andrew. That's really helpful. Maybe the other question was around the monitoring, tools that are being how monitoring is done. Because you said monitoring is a very big problem when it comes to these projects. So I wanted to understand if still there are any tools that are being used that can help you be able to to track the performance of the different people in the entire value chain of when it comes to, for example, immunization. There are tools that you've been able to deploy at the district level that can help you gather different pieces of information that's helping on your side, or you let the government implement their own tools and then they can give you maybe feedback later. How is it done?
Yeah, personally, I mean, in Uganda, they have discouraged parallel tools. I think it's only HIV because of the heavy funding that comes from US implementing partners, and therefore sort of they have had an upper hand in directing. There, I'm told they have their own tools that bring in information to them, but otherwise all the other partners use government tools, and we have the HMIS, and it has all forms of tools, and that's all we use in terms of bringing forth some of the information we need. But I know, for example, that with SPT, we've had discussions on how can SPT be used to really help us. I think one of the challenges, which unfortunately, at least from the point of Gavi, they seem to not again be enthusiastic about it, is you can't have good performance if your money or funding is input based. Because at the end of the day, I think we are people that are not that honest, and people will give you, even though they'll bring the data or the information through, it may not be accurate. I think if we had results-based type of tools that would really strengthen payment or whatever based on performance, true performance, not the corrupted performance, I think would be getting better outcomes and better results. So yeah, that's my answer to your question.
Have you had a chance to look at the SPT tool?
Yes. I have tried to work closely with the SPT for some time, and I think it's really a good tool. I think the challenge that we keep hearing is on the scanners and the ability for the scanners to be at most points, and also that seems to be the only hindrance. But otherwise, I think the SP2 really resolves quite a number of our challenges we had in the past.
Fantastic. Thanks so much. Over to you, Jaka.
Yes, I think Ibrat has a question.
Thank you, Yansha. Excuse me. Andrew, it's really interesting to hear you talk about your experience. You've mentioned earlier about, some of the headaches around, in response to Ian's question, some of the headaches around funding. Are you closely involved with the funding processes and all that kind of stuff?
Yes, I am.
Yeah. Could you tell us a bit more, like, because you said, if only you could solve that problem, you would see better. Could you tell us a bit more about, what are those headaches? What is it keeping you awake at night, so to speak, even if not literally? How does it work, or rather doesn't work? What doesn't work, and what kind of headaches does it create for you?
In terms of, I'm not clear about your question, because I told you the biggest problem we have is the accountability. The funding, we can send money by a click of a button and it reaches the district. So the challenge has always been in once it reaches the district. For example, I told you, if it is off budget and is not for an activity that is already planned for in the district's plan, then the districts have to approve it using a local council or a political structure of councillors that sits and approves that additional money that has come into the district. So when you have money in the district and that had not been foreseen, then it is a whole big delay, because getting these councillors in a district, you'll have about 12 councillors. They come from so many different parts of the district. It becomes a big challenge. So we've had delays in approval for up to 6 months that being one of the obstacles. The other that I shared, I think, was also on the fact that when it hits the district account, the chief administrative officer should be very in the know on, number one, the plan for utilization of those funds, but also the urgency. So most times he's not well briefed and he's not aware. So that also causes a challenge. The third one and the last one is now, how do you retrieve these accountabilities? Because teams go out and maybe pay health workers that are out going on to a campaign or maybe even routine, but then getting back that accountability to the district level and having the district level review that accountability. There's also, as I said, it's a decentralized system. So at the district level, they have auditors, they have accountants. So all these, when you go to the field and pay workers, whether it's by electronic payment or by cash, you have to bring all these documents and get them through the system of the district. So the accountant will have to review that document, the auditor will have to review it, and then finally it goes to the chief administrative officer to sign off. So in there, you also have those delays. So yeah, transferring money is not a problem. Maybe if you say transferring money to the last or the last user, who is, for example, a village health team member who is actually, hello?
As you're saying, the final recipient in this case.
Yeah, the final recipient, therein lies the problem, because currently the districts have always used cash, but the Ministry of Finance and some of us are as partners, we are discouraging cash because cash has so much temptation. So we're trying to use electronic means. As WHO, we've piloted a system of having what we call a pre-validated data list of all health workers and community health workers, so that if you have that list of all your health workers, whenever you have a campaign or an activity, you can just tease out the names that have been involved, and the database is already accessible both at the national level and the subnational level. And you can pay directly to, let's say, Andrew's number, because in that database, I will have validated my number and my name and signed it off. So if you have that, then paying a village health team would be very easy at the lowest level of a village. But currently, it's not that easy, and districts are still insist on paying them by cash. But I mean, we know the challenges with cash. Over to you.
Yeah, I have a follow-up question, Andrew, because now we're talking about how the money is sent to the districts and that the limited accountability. But can you maybe say how many times is the money sent during the year, and how many times do they have to account for? Is it every month? Is it per quarter? How often are we talking?
So the routine activities, money is sent through quarterly. For, like, let's use the example of routine immunization. Money is sent through quarterly, and so they have to account quarterly. But then there are so many other activities that come up that are not within the routine. For example, I keep using the example of campaigns, MR campaigns. Now we are planning for a yellow fever campaign. We have just finished a measles rubella campaign. In February, there was a polio campaign. So those ones are as and when. But then also you have your other activities. For example, during the Ebola outbreak, we as partners, but also the ministry, are sending money directly to the district to support in various activities. And that was also going through as and when. So you have your routine, which is generally quarterly, but you also have your so many other, I would call them ad hoc activities that happen daily, weekly, monthly, whatever. Over to you.
Yeah, so it seems like a lot of funds being sent, especially.
Yeah, we pay money all throughout the year.
Yeah. So then, I mean, just hearing you talking, it's already very complex. So I cannot imagine how it actually works in real life. But then we brought up innovations, and you said that it would be amazing to have an innovation, but at the same time, not really possible in the current settings, in the current way the system works and how complex those mechanisms are. So what do you think would prevent any innovation from working, but also what could be actually brought up to the market? Because we have moved way forward with innovations and using technologies and in the healthcare system. So what do you think could be implemented in the upcoming, well, months or, yeah, very short period of time?
So I have to apologize if I made it too complex that you seem not to have a smooth path through the web of challenges. But I can assure you that I am one of those strong believers that technology and innovations can really solve these this spider web of challenges, because I mean, if you look at the complex way in which everything I've shared with you is, you can have one path that is electronically certified that just gives one, for example, one way of sending money and one way of sending it back. Right now, it's so many ways, but if we had one innovation on one electronic way of payment, and also maybe a better way of accounting, then you don't have all these challenges. So I strongly feel that the presentation of this complexity is actually a fertile ground and opportunity for innovation and technology to get a path through and give us a solution. I'm one of those strong advocates for that. So if I could give an example, just like I think it was Ian who mentioned it, if you have a way in which you say, let's use an example of even routine immunization. If you say, I have sent, well, we have immunization at the district level, there are outreaches, you say, this person is going for an outreach and it's only after the outreach that he would be paid. So you don't have this narrative I've been telling you, oh, you send money, then it gets this problem. No, you would say, so and so, go and do an outreach. When you reach there at the outreach, have some electronic way of proving to us that you've conducted this outreach, have an electronic way of capturing all the children that you have immunized, and then send it to the district. The district either approves it and pays, or send it to the national level, and we send to you directly. We have your number, we have every detail. What is difficult? So I'm telling you that innovation and technology is the way to go. It sorts out all these issues I've been telling you of a council sitting, and then you have a chief administrative officer not being there or not knowing, then a chief finance officer. Now you're dealing with a person who goes and vaccinates, sends you the data, you pay, and everything is sorted. 1 click, 2 clicks, and all of us are happy. Over to you.
Yeah, all of us would be happy. This sounds very simple, and it seems like it's so basic and so straightforward. Why is it not yet in the place? But also you mentioned like health workers being paid, having the visibility of the services they've provided, and then being accounted for. I feel like this also moves us to results-based financing, where you could, if you would have the visibility of the services provided, and if you would have the transparency of the money that was spent and on what, it would really bring you, to like shift towards a results-based financing mechanism where you would see improved outcomes and you pay for them.
Yeah, so one of the things I can say, which is such a great opportunity like never before, is the fact that because of these frustrations, which I've just shared with you, everyone is very open to a different way of doing this. So, for example, much as I've said that Gavi, for reasons I don't know, is not very excited about results-based financing, the Ministry of Health, and we had a meeting with PS last week in regards to the yellow fever campaigns. And he's like, give me any solution apart from telling me to send money to districts which have not accounted. Please tell me any solution. So as I'm saying, this presents to us the best opportunity you can ever have. Government, which is the greatest funder or money mover in this whole equation, is like, you guys, I'm stuck. I don't know what to do. Give me a solution. So yeah, it's the greatest opportunity we can have for those who are in innovation and technology.
Yeah, absolutely. It's also an amazing opportunity for us because with SPT, we're moving towards a smart payment mechanism to exactly overcome and address all of those issues that you have shared with us. And if the ministry sees the importance to remove this painful process, then it would be amazing to work on this together and make it possible and finally shift.
Yeah, just a quick one, Andrew. If we had a tool that was ready, for your testing, how easy would that tool be, easy to implement in your projects? And would we come to WHO? We go to the ministry For example, if we had, a payment solution tagged to a monitoring tool that allows you to track, someone who has done the activity, but also is able to, once that activity is done, it sends a message where you are able to, to request a payment, and that payment gets approved, and instantly the person who has done the activity and they are happy, they receive a payment straight into their phone. If we had a solution which is ready for you, to take out and test, how easy would it be, to implement within your projects? And whom
No,
would you talk
it's
to?
very easy. You'd have to use us as either WHO or one of the IPs, because that way you would have an entry at the national level.
Yeah.
Through the ministry. They have such a firewall against any new electronic, but not against, sorry, the modality of getting it through their system. So what happens, for example, like with me and my new area of work, is that we can initiate and pilot and do anything we want at the subnational level with any tool or anything. So I can use my area as an entry and then work it out. And if we have good results, present it to the ministry with very convincing arguments, and they would buy it and adopt it.
Over then we scale it.
Yes, sure.
Fantastic. Fantastic.
Yeah.
Andrew, you mentioned earlier that you've been involved with it or supporting SPT for a while. What is it about SPT that appeals to you? Why SPT? And how do you see it helping you?
No, the SPT was helpful because one of the challenges we were having is getting information from the service points back through the chain of reporting to the national level. So the SPT was helpful in the sense that with the paper, you would have to first take it to the next level, compile all those papers, enter them electronically. So it was so labor intensive, the previous method. But now with SPT, you just scan and then your data is converted electronically to the next level. So analyzing and trying to put it together becomes so easy. So that is what SPT has really brought in as a great advantage. I think where we are now seeing that sort of like the thing that I also actually wanted to ask you guys whether maybe there's a way in which to improve it, is because we can't have scanners at every place. For example, when we're piloting in COVID, we put a scanner at the district level, but remember the district has at times even more than, let's say, 100 facilities. So all this bringing in to be scanned is really a challenge. So my thinking was, if you had a way in which the information from a lower level could be entered immediately as electronic, and then it goes up and is maybe consolidated somewhere higher, then that would solve what is currently seen as the challenge with the scanners not being accessible at the lowest point. But yeah, that's my understanding of SPT.
I'm very glad that you mentioned this with the scanning stations, because now, of course, they are distributed mainly in the districts or some bigger health facilities. And we are aware of this, and the team has been working intensively the past year to introduce a new kind of optimization of SPT, and we will have a mobile scanning. So, and it will be offline and then synced later on, so that the health workers themselves can use the smartphones to scan those forms, and they don't have to submit it to scanning stations. And this is one of very many other optimizations that we have been involved in to, to make it more beneficial. And I'm quite interested and quite excited to see it in action very soon, to switch to this new SPT 2.0, if we can call it that way, as well as the smart payment mechanism.
Oh, that's amazing. That would be good. We look forward.
Yeah. Do you guys have any other follow-up questions? Because I'm thinking we're mainly touched upon the accountability today and the payments. And I think this is a huge topic. It's extremely important to raise the awareness of it and interesting. But I believe, Andrew, there are also so many other things that you have incredible insights into, and I would want to hear more. But I don't know your availability, and I'm thinking that maybe we could also organize another call and focus it more on the strategies of immunization, zero dose, under-immunized. I'm not sure how well involved you are in it, but I believe you have a lot of knowledge that could be shared.
Yeah, I think we'll always have time. Just reach out to me, Yancha. You know, with me, it is just a matter of trying to propose, and we see there's never any open time and if no free time, but we can always make a way, just like we've done now. So let's keep the conversation, and yeah, just inbox me and we see what we can fit for the next time, and we'll have it.
Absolutely. And I think it would be also great to meet with you, just to perhaps showcase you all those optimizations so that you're aware of what we've been working on during the past months, and not only the mobile scanning, but also when it comes to how SPT could address the accountability challenges and how it could be used to provide this visibility and transparency.
Oh, okay. I think we can meet and just have that insight and see visually what you mean. Let's see when we can meet. Just inbox me.
Absolutely. And I think, you know, Rustam will be in Uganda very soon, maybe next week. And I might come as well, so we can do it also in person.
Okay.
Wonderful.
Okay, dear.
All right, Andrew, if no one has any other questions, then thank you so much for joining us today and providing those the knowledge that you have and the experience. It was very valuable to me, and I believe to others as well.
Thank you, guys,
Yes.
and have a good evening.
Thanks, Andrew.
Yeah. Thanks so much, Andrew. Have a good evening.
Thank you so
Bye for
much,
now.
Andrew.